bone marrow aspirate concentrate and delivery in hip arthroscopy. Here we present a 17-year-old male with a left hip labral tear. A Jamshidi needle is used for this surgical technique in obtaining the bone marrow aspirate. We use a dry model of the iliac crest just for demonstration purposes, and here you can observe the incorrect placement of the bone trephine needle and observe the cortex blowout. After this, we correct the position from a medial to lateral position and an anterior to posterior position, so we can be on the entire body of the iliac crest and we can introduce properly this Jamshidi needle for the harvest of the bone marrow. Posteriorly, we tap the mallet towards the bone, and after this, we take out or remove the sleeve of the Jamshidi needle. You have to make some counterclockwise turn to prevent from blood clogging of the cannula. Here you can observe now in our patient, which is in the modified supine position, and this is a left hip. Here we mark our landmarks of the anterior superior iliac spine. In this case, it was a patient that we did a hip injection because of post-operative pain. We do the same maneuver. We inject with lidocaine the skin and also the fascia of the anterior superior spine. We feel bony contact and we also inject the bone. This is injected with narrow pin, and after injection we will use a 11 blade to make a small wound puncture to introduce the needle, as you see here on the video. We will repeat the steps that we did in the dry model as we use as an example, changing the position from medial to lateral and from anterior to posterior to get access to the entire body of the iliac crest. After achieving the correct position, we proceed to aspirate the bone marrow with 5 cc syringes. The marrow aspiration is with 8 syringes of 5 milliliters, and we can obtain up to 30 to 40 ml of bone marrow aspiration. Now, at the back table, all the syringes with the bone marrow aspiration are ready to be concentrated on the centrifuge system machine. The bone marrow concentrate is now ready to be placed and delivered into the hip joint with a closed circuit recovery system. Here you can observe a labral graft which is going to be placed on a patient for a labral reconstruction and to help with its healing and incorporation onto his hip joint. For the BMAC delivery, we use a 8 neonatal nasogastric feeding tube, which it will be placed into the hip joint with a arthroscopic grasping forceps. Posteriorly, we have to dry this joint, and you can use a regular suction tube of your shaver or your radiofrequency wand. We usually don't dry the joint with gauzes, and you can observe here in the arthroscopic image how the joint is totally dry and the neonatal nasogastric tube is placed towards the acetabular transverse ligament and retracted to be placed on the labral repair or reconstruction or the chondral lesion. Thank you very much for your attention. Muchas gracias.